Hello, my friends. How you doing, Dr. Mabanta? I had a patient come in this morning who just recently gave birth to a beautiful baby boy. Big kid too. He's like 10 pounds plus. Beautiful child. And I was asking her how she's doing, how she's feeling, and she said, "I'm exhausted. I'm so tired, and baby's not sleeping that well, so she's having some disturbed sleep." And so, I mentioned to her, and one of the areas that I think is very important is the post gestational period for women, specifically in the area of balancing and recalibrating their hormonal system. Obviously, throughout the whole gestational period, while you're having that baby develop in that 9-month period of time, there's a lot of hormonal and endocrine changes that are occurring. Hormones created to relax the ligaments and tendons of the body, estrogen levels changing, progesterone levels, adrenal changes. A whole cascade of hormonal activity is shifting very rapidly. Not to mention the structural changes that are occurring. Your body's going from its normal condition, pre-gestational, pre-baby condition, into this condition where it's going to be carrying 25 pounds of extra fluid, infant, and tissue that's been developing in you for a 9-month time period. So a lot of change. After that time period, when the woman gives birth, this particular woman had a C-section. So there was a surgery involved, so even more recovery because of the traumatic surgical procedure that was done. Even more healing is required. The point that I'd like to make is that after that time period, it's so important to nurture the mother in addition to nurturing that child, because that mother is still trying to recover her endocrine system. She's trying to recover structurally from that dramatic change that is occurring. So one of the first things I like to see after giving birth is a chiropractic adjustment. It's one of my favorite times to adjust somebody, and it's a period of time when you can help that mother's pelvis, lower spine, restore back to its proper alignment, thus allowing the nervous system to work better and control and regulate those hormonal changes that are occurring. Also, rest, nutrition during that time for the mother and the infant is so important. A lot of moms jump back. Sometimes they have other children and they're trying to get back into the schedule of managing and caring for the family, and they're putting a demand on their body and their endocrine system again. So too much activity, too much stress after the infant, which is often a stressful time, can put a demand on that mom's endocrine system again. So think about these things, when a child is born. It's a beautiful time. It's a beautiful time for the family, and give some extra care to that new mom so that she can restore herself back to her health and care for the family like so many powerful women do in our society. So thanks, and I'll talk to you later.